Good morning. Good morning. Good morning, guys. It's 8 o'clock. We need to get the meeting started. If you would, please take your seats. Good morning. Welcome to the full committee of the House Insurance. Representative Hawkins, would you say a word of prayer for us as we open? I do.
Please bow your heads. God, lay your hand on us and bring us to this position and this day with good hearts, good minds. Let us make decisions that are the best for our patients, for the people of Georgia, for our families, and for the folks we serve here at the Capitol and our colleagues. We ask this in your name. Amen.
Amen. We have two bills before us this morning. I see Senator Kirkpatrick is with us. We will start with Senate Bill 80. You would please come to the microphone.
Thank you, Mr. Chair. Can I shed my mask momentarily?
That's
okay. Thank you. Many of you are familiar with this bill, but this is Senate Bill 80, and I'm working from LC 460457S. It's the ensuring transparency. Is that correct? 75S, sorry. It's the Ensuring Transparency and Prior Authorization Act. The Senate version of the bill passed our chamber 50-0. There have been revisions to the bill both before and after Senate passage. It's been a long process. Many of you know that I practiced orthopedic hand surgery for over 30 years, and I have a lot of experience with the prior authorization process for getting approval for medical treatments, tests, surgery, and drugs. Over the years, the process has become more time-consuming and difficult for healthcare providers, and much staff time dealing with this process could be better used providing patient care. I imagine any of you who have been through this process as a patient are very familiar. This consumer protection bill does not argue whether the process is good or bad, or whether it saves anyone time or money or helps or hinders patient care. It simply attempts to add some rules of the game and also to provide transparency for the process. In the interest of time, I'm going to hit the highlights of the bill, which amends Title 46, which is the law already in place for healthcare utilization review, which is managed by the insurance commissioner, and for state plans by the commissioner of DCH. Article 1, which covers the first 16 pages of this long bill, it covers existing law and adds several new definitions, including utilization review, medical necessity, clinical criteria, clinical peer, and urgent healthcare services. Article 2 adds new code sections that do the following. Requires that requirements for prior authorization are available to providers on the insurance company's website, and that the clinical criteria used are available at the time of the determination. And also any changes to the criteria must be updated on the website as well. It also calls for aggregated statistics by carrier and by plan to be available on the insurance company's website with information about approvals and denials. It calls for peer-to-peer communication before an appeal, and it defines the qualifications of a clinical peer. It states that prior authorization, once it's approved, is good for 45 days, provided the service takes place during that time frame, except for Schedule II drugs. And it establishes a timeline for making these determinations, which for urgent cases is 72 hours. For elective cases, currently in the bill is 15 days. It does not require prior authorization for incidental findings that happen in surgery in an urgent situation. And it also honors a prior authorization if the insurer changes their utilization review entity, or if the patient changes plans within an insurance company for 30 days. It establishes a procedure for handling violations and also clarifies the role of the Department of Community Health. This bill, as I mentioned, has been through a lot of changes. It's not everything that everyone wants, and I'm committed to continuing to work on improvements for this issue, and I'd be happy to answer any questions.
Thank you. Committee members, do you have questions of the author? Chairman Hawkins.
I want to thank the author of the bill for bringing this piece. We don't always get what we want, but like the Stone said, sometimes we get what we need. And you put a lot of stuff in here that is really going to be helpful for the patient and, and the provider, because we're back to where we were years and years ago, where the appeals are going to be reviewed by peer to peer rather than speaking to someone that's not even in the healthcare field. You've got in here that the insurance companies are going to honor their authorization for 45 days unless there are errors, fraud, or material misrepresentation, which is fair to both sides. It helps protect them from claims that may be fraudulent, and it also helps the patient and the provider. And you've got Schedule II drugs in there, which we focused on for so many years. So, there's a few things in here that obviously some people want, and things that in here that some people don't want. But I think you've done a very good job, and I want to thank you for this. It's going to help a lot of patients. Appreciate it.
Other questions from the committee? Representative Galton.
Thank you. I want to almost reiterate what Chairman Hawkins was saying. I have a number of constituents who are doctors who really like this. I have a number of constituents who are patients who have dealt with this process. My wife has dealt with the process with prior authorizations, and it's especially when it's a medicine that you really need for something that's going on. When that year comes up and there's a surprise prior authorization, it sometimes does take a week, and that can be really detrimental to the patient as we go through. So the timing is really important to patients because their health care is so important to them. So thank you for the bill, and I think it does a great job of balancing everything. So thank you.
Any other? There you go. Will Williamson.
Thank you, Mr. Chairman. To Doctor, I appreciate you bringing this measure as well. So I'm just going to ditto what these two gentlemen just said. I do hope, and as I brought up in the subcommittee yesterday, that as efficiencies in communications, via on the electronic platforms we're on. I know that many doctors' offices are going totally electronic. I don't understand that process, but as a business guy, I know that having come into business when everything was on a manual typewriter with now we've got supercomputers. I would hope that we can move towards better in this 15-day turnaround on elective surgeries after obtaining all necessary information. If all necessary information is there, and I understand there has to be a peer review process in place, but I'm hopeful that we can see that calendar days shrink down for the betterment of the healthcare that's trying to be practiced in Georgia. If that's the national average, I'd like to see us be better than average is what I'm trying to say. So thank you for your good work.
Thank you.
Thank you. Any other questions from the committee members? Are there any online? I see none. Any further discussion? All right, I will entertain a motion. Motion and second. All in favor, say aye.
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 Any?
Aye.
Okay, I think we have our own line, and any opposed? Like sign? I see none. Thank you. Your bill passes. Thank you. All right, we have one other bill, Senate Bill 82 is Senator Al with us. Please come to the podium there, to the microphone. You would please present your
Morning,
bill.
everyone. Hope everyone had their coffee. It's nice to see everyone here. See a lot of familiar faces, and I pre-apologize for people who are hearing this bill presented for the third time. I'm Michelle Au. I'm over from the Senate side, and when I'm not doing this, I'm a physician over at Emory St. Joseph's Hospital. So thank you for allowing me to present Senate Bill 82. This is a patient protection bill which seeks to clarify insurance coverage of emergency medical care. This is a bipartisan bill. It's a very straightforward bill, and what it does is it closes a harmful loophole And hopefully with your favorable consideration today, I hope we can help a lot of patients. I'm gratified to also note that this bill passed 50-1 in the Senate and passed out of subcommittee yesterday. So thank you for everyone for helping. I appreciate the excellent suggestions I received from my colleagues, both on the House side and the Senate side. Thank you to Mr. Vince Wiegand for helping us work through all the versions of this bill, and Chairwoman Darlene Taylor for her helpful suggestions. I'm going to talk through some of these changes in the bill in just a bit. So just to recap what this bill is, the problem that we're aiming to solve with this bill is the problem we're aiming to solve is the phenomenon of insurance companies denying claims for emergency medical care when the insurance companies decide after the fact that the patient's presenting symptoms or concerns don't qualify as emergencies. So again, just to make this point, the claims that we are aiming to cover with this bill are not ER visits that were made for trivial reasons. The kind of patient presentations and cases we're talking about are patients who are coming in with crushing chest pain, patients coming in with broken bones after car accidents or after incidents of domestic abuse or trauma requiring police intervention. We're talking about patients with gunshot wounds coming in. We're talking about patients coming in with critical sickle cell crisis necessitating hospitalization. All of these that I just mentioned are examples of real claims that were denied by insurance companies that reviewed the patient records afterwards and determined that the reasons that they came in did not meet their correct threshold for emergency care. Now, this bill is premised on a legal precedent, which is known as the, quote, prudent layperson standard. Let's talk about what this means. The prudent layperson standard requires insurers to cover services where, and this is the language, quote, a rational person without professional or specialized knowledge in medicine would believe that their condition is one of many emergency medical conditions. For example, most commonly heart attack, stroke, severe injury, threatening bodily function, those types of things. And this bill simply points out the obvious that we don't always know when a patient, what a patient's condition is when they first present to the emergency room. But if they meet this prudent layperson standard for seeking that emergency care, this care should be covered by the health insurance policies for which they have paid and which they have for this very reason. I had some expert testimony come in yesterday. All of the information that you should need to flesh out the full scope of this issue should be in your packets. There was also at the top of the packet a House committee report that you all commissioned in 2018, detailing the scope of this issue and recommending that the legislature take measures to rectify this harm against patients. So that's what we're aiming to do today. It's in response in large part to that House study report. And I thank you all for commissioning that and looking at this issue. I'm going to walk briefly through the changes we made to this bill just prior to the subcommittee meeting based on your excellent and well-considered recommendations. And again, I thank Chairwoman Taylor for her input. Today, we are working off this version of the bill. It is LC 460468S. This is the most recent sub. We just changed a couple of things. The first thing is in lines 25 through 27, we added a carve out for ERISA, Employment Retirement Income Security Act plans. So we have that. And then in a couple of other spots, lines, sorry, my tabs on 83 to 84, in line 85, and also in line 26 and 326 and 327, we added emergency medical technicians to the list of healthcare providers. And those were basically the changes we made just prior to subcommittee on Chairwoman Taylor's suggestion. So I'm going to just wrap it up because it's pretty early. And if anyone has any questions, I'm very happy to entertain them. But just in closing, there are two harms that we are aiming to avoid with this bill. The first harm, we're aiming to avoid patients being unfairly burdened with the debilitating costs of emergency medical health care. So that's number one. The second harm we are aiming to avoid is patients perhaps hesitating from seeking out necessary, urgent, or emergent healthcare because they are concerned about maybe having to shoulder these costs because of this history of insurance claims denials retroactively. So with that, I ask for your favorable consideration of SB 82. Together, I think we can help a lot of people who have been harmed. And with that, I'm happy to take any questions anyone might have.
Thank you for your presentation. We do have a few questions. 15. Representative Hawkins, Chairman Hawkins.
I just want to thank you also for bringing this bill. I know you worked very hard. Sometimes this can be a difficult subject. Sometimes patients are arrive in the emergency room by ambulance only because they don't have to wait 2 hours. They come in the back door and see it immediately, and that's not a true emergency. And insurance companies are in a position of being forced to handle something that didn't pay for something that's not an emergency. It's really the patient's responsibility. But then the providers are also stuck because they cannot screen patients. They have to treat the patients that come in the door. So it's a tough subject. But I just want to thank Chairwoman Taylor for this bill. I know she worked hard with you, and I know that she had some concerns and worked things out. So thank you both.
Thank you. And I really thank you for bringing up that issue, because sometimes we do get into these discussions of reasons that people come into the ER. And I want to point out that this bill does not address these cases where patients do come in for more trivial reasons, call an ambulance just because it's faster, these types of things. That does not meet the prudent layperson standard. What this bill aims to address is people who do meet the prudent layperson standard and still are not covered. So this is a subset of patients that really should be covered under emergency medical care coverage.
Representative Williamson.
Thank you, Doctor. Just a couple of quick questions. I apologize. I missed the majority of your presentation yesterday afternoon. I had to step out, but a couple of questions. I'm going to go in reverse order. Who in the House is going to carry this bill for you?
Representative Sharon Cooper is going to carry the bill in the
Okay.
House.
The second thing, just trying to be fully educated. Did anybody from the insurance industry oppose this bill, or do they sit down and work with you on it?
They have not opposed this bill. I will also note two things. One is that when the House committee report came out in 2018, they actually also solicited if the insurance company wanted to weigh in. They did not. They chose not to. The second thing I will point out is that Blue Cross Blue Shield Anthem, which is the primary insurance company that is perpetrating this phenomenon, is actually embroiled in a federal lawsuit at this moment for this very issue. They are being sued by the American College of Emergency Physicians and the Medical Association of Georgia because of this phenomenon of retroactive claim denials from patients. So that might be part of it.
Just a follow-up question. I noticed in your handouts on page 6 of 15 on the section dealing with Anthem, they mention save the ER for emergencies or you'll be responsible for the cost. And they put in small print, this isn't a change to your benefits plan. But if the industry's not fighting it and it's going to help fine physicians such as yourself deliver better health care from Georgia, I think it's fabulous. Appreciate the work and proper time, Mr. Chairman. I'd like to make a motion.
All right, sir. Are there any other questions from the committee? Any online? I see none. I guess this is the appropriate time.
Move do pass.
We have a do pass and a second. All in favor, say aye.
Aye.
We have a Representative Gamble.
Aye.
Aye. I'm on 12, I'm sorry. I would like to make a friendly amendment to the bill. And I know we've spoken, Representative Taylor and Senator Al. The set part about the EMTs on page 4, I don't think that it was the intent to also include EMTs also on page 8 and 13. So my amendment would be just to strike on page 8 and 13 the EMT reference, but keep it on page 4. And the reasoning for that is that these are definitions of providers that bill individual services, and EMS doesn't do that. They bill as a company for transport. So that would just clarify that a little bit better in this legislation.
Thank you for that suggestion, and that is a great point. I've spoken with some people about this issue, that emergency transport is a bundled service, and EMTs themselves do not bill the same way a physician or a PA or whatnot would bill. So I think that's an excellent point, and I'm happy to do that if it pleases the committee.
And by one, we're having to make some decisions. All right, we had completed the vote before the we have to now entertain a motion to recall the vote. We have a recall, a motion and second to recall the vote. All in favor, say aye. Aye. All opposed?
Aye.
We're all good. Now, back to your amendment, please.
Okay, again, I would like to make an amendment on on page 8, specifically line 85, that we strike emergency medical technician. And then also on page 13, line 26 and 27, that we strike emergency medical technician. And that is the amendment.
I'm happy to accept that if it pleases the committee.
Legislative Council, are you clear on what the proposed amendment is? Okay, we have that. Are all members clear on what the proposed amendment is and does?
Yes, sir. On page 8, line 85, we would strike emergency medical technician, and also on page 13, lines 126 and 127, we would strike emergency medical technician.
And just to be clear about the striking, we're not saying that emergency medical technicians aren't healthcare providers. Clearly they are, and they do an incredible job in the field. This is just a matter of who's considered the billing party
Correct.
for insurance purposes. So this is that clarification.
All right.
Yes, I do. Yes, absolutely, I do.
And number 16.
Thank you, Mr. Chairman. I just wanted to clarify that section that is being changed would be tying to reimbursements and filing claims. And the technicians do not file individually, and it would expose them to liability that they really shouldn't be exposed to. So I appreciate this amendment. Thank you.
That's exactly right.
All
Thank
right.
you for pointing that out.
Okay, all clear on what the amendment is? All right, I will have a motion and a second to move up on the amendment. All in favor, say aye. All opposed?
Aye.
Aye.
LC 460-468S is amended by the Insurance Committee. I move do pass.
We have a motion and second for the bill as amended. All in favor, say aye.
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 All opposed, like sign. No, there are no votes, so your bill passes and put on to move.
All right.
All right, thank all of
Thank
you
you,
for being
everyone.
here this morning. Have a good day. We're dismissed.